everybody. You're welcome to today. We just let us know in the comment section where you're watching from, and yeah, and also we'll be taking out some time to. We have about a few persons already on ground, so we'll be taking out some time to know the countries that are watching us. Okay? I'm hearing myself on repeat over there. Can you hear me?
Cup sit down.
Can you hear me?
I can hear you.
All right, because
I
I'm hearing myself. I don't know if I'm playing out there.
not too. He's hearing himself. Maybe put that on on your speakers.
Okay. All right. So everybody, you're welcome. So we're about to start. Thank you everyone. Yeah. Feel free to use the comment section. So can everyone hear me, please?
You can bring the iPad. I can see on the iPad.
All right. Yeah. So somebody say it's buffering. Yeah, it's buffering. Yeah. All right. So we need to. Wait, I don't know where the sound is coming from. Can you hear me, Doc?
I can hear you really well.
Yeah, I'm getting a feedback, so I'm trying to know where that feedback is coming from.
I don't
But
have
it's
any other
fine.
device turned on, so
All right, so we can start. We can start. I think we have about So Doc, you can okay. So they can hear us clearly now. All right, that's perfect. Okay. All right, Doc. You're
yep.
welcome. You're welcome. So guys, sometime last few months, I came online and I happened to just dabble into Dr. Anne's video, and I watched that video. I'm like, who explains these things this way? Very, very clear. Very I mean, I saw the video because I've seen many people talk about this doctor route to Australia, but they didn't explain it the way she did. Very simple, and she didn't even like she wasn't pushing much. She was just making it very easy for people to understand. So I said to myself, "Oh, the only thing I can do is to reach out to Doc and be able to see how we can be able to have a time together, and so she can be able to share this particular um stuff with you guys. So I want to welcome everybody once again. So Dr. Anne, the floor is yours. Can you start by introducing yourself, and let's kick off.
Oh, thank you so much for having me, Precious. It's a I I'm grateful for the opportunity, and like you said, ours was an interesting meetup. But like I always say, for me, sharing information of how I did it so that we can help somebody do the same thing is what drives me. That's my why. So my name is Anna, Dr. Anna, as most people call me. But I currently live in Western Australia in Perth, and I work here in Perth as a medical doctor. Yes, and how many years now? About seven, almost 8 years now. Yeah.
Okay, okay, Doc. So, guys, I just want to be sure that you can hear what we're saying.
It says
Let's
not
make it,
all going smooth. I don't know.
yeah. Jay, is it clear now? Just give us an info. We're having a feedback from somewhere. Guys, if you're joining in, let us know if you can hear us clearly and if it's working fine. All right, Dr. Ann. So let's forge ahead.
Okay, sounds good.
Yeah. So from my end, I could hear what we've said before on my platform. So I don't know if you can hear that from your end.
I can hear you really well.
Okay. So all right. I would agree that everything is working fine then. So Dr. Ann, so let's get into what we have today. So about coming to Australia as a medical doctor, whether from Africa, whether from any part of the world. So um so far, how has been your experience, first of all, working in Australia as a medical doctor?
I love it. I must say, I love working in Australia. Um, yeah, it's been a couple of years settling in, so I think the initial years can be a bit, tricky finding your balance. But eventually, once you do find your balance, it's really good. The pay is good, the work conditions are good, the work life balance is perfect. And I think the greatest thing for me is having my kids live here and enjoy life here and to have what I have. I mean, I must say, I wasn't so badly off in my country, but the work conditions were different, definitely different. I used to work in emergency department and the challenges of working in my country were there. But I think crossing over, I allowed me to see and acknowledge the differences because you have to know where you've come from and acknowledge that to for you to be able to tell whether life has changed for you or not. So for me, I feel working in Australia has been extremely amazing. And the same can be said of my family. We love living here and it's amazing, I must say. Yeah.
I'm not amazing. All right.
Starting out, sitting the exams, there wasn't too much information as there is currently. So I didn't know how, I didn't even know my study, my way of studying. It has completely changed. I mean, now people are extremely lucky because there are various ways that you can study and prepare for the exams. It was a hassle, having the funds then to come. But I always tell people if you want something, you will make it happen. If you want something really bad, you will go at extra cost to make sure that
Yes.
you get it.
Yes.
So, despite the challenges with finances, we were like, this is it. We have to make it work. So, we got the finances and then did the exams. And if you want me to talk about that in detail, I can always do. But then eventually landing here and starting my first job. And I joke and I say it was I started working in CCU, which is coronary care unit, and I'd never worked in such an area before. Mind you, I'd worked a lot in emergency department, but this was a different ball game altogether. So part of the challenges was like being thrown into the deep end, being thrown into a unit that I'd never worked at, looking at ECGs every single minute or every every other minute, looking at ECGs and managing patients that had come through the unit. So that was my first challenge. But I think, and I always say, at the end of the day, you are a doctor in your own self. Yes,
Yes.
the systems will be different. Yes, the structure in the hospital will be completely different. But at the end of the day, you're a doctor in your own sense. So you will somehow you will have to make it work. You will have
I
to
have to
just
make
get
it
in
work.
there.
That's the word.
You've got to make it work because at the end of the day, you've got family and you've got everybody looking up to you. And again, you don't want to go back home because you packed up and told everybody you're coming to Australia. So you've got to make it work. That was my biggest challenge. Is of course adapting for my kids as well, getting schools, getting accommodation. But eventually, the other challenge that I've gotten around over time is finding my pathway in training, getting myself to where I am as a general
All right.
practitioner and all
Okay.
that. Yeah,
Okay.
yes.
Okay. All right.
Challenges
So
will be there.
yeah. All right. So thank you so much for that. So we'll
Yeah.
go to the next one, which is I know that's why most people are here to hear about how can I be able to migrate to Australia as a medical doctor. All
Okay.
right. So, where let's say I am a medical doctor right now, somewhere in Africa, somewhere in Kenya, somewhere in Nigeria, somewhere in any part of the world, and I say I want to come to Australia in 2024 or 2025 as a medical doctor. What is the first thing that I should need to do? The first
Okay.
things I need to do.
All
Yeah.
righty. That's a very bold step, which is good. I think the first step is to understand the processes, the pathways for coming to Australia, because I'm sure a lot of the people that are watching me have different backgrounds. So it will be either as a junior doctor or as a specialist or somewhere in between. So you have to we have to understand the processes. So there are various pathways, three pathways to be specific, that people can come to Australia on. The first pathway, obviously, is what we call the standard pathway, and this is the pathway that we use by a lot of junior doctors, including myself.
Doc, Doc.
Yes, yeah,
So you said pathways. I'm
yes,
trying to emphasize on that because
yeah,
people are asking that question now, and I want them
yeah.
to listen to what you're saying. So you
Mm,
said there are many pathways for doctors to come to Australia. So now
yes.
start again so that you can elaborate it. Okay, three pathways, no
So there
problem.
are three
All right,
pathways. The first
three
pathway is
pathways.
what we call the standard pathway. The
Standard.
second one is what we call the competent pathway. And the third one is what we call the specialist pathway. Okay. So easy said, specialist pathway is for people that have specialized in their countries and they're already, specialists, like let's say, whatever specialist you're in. And then the competent pathway is just select few countries. So that's Ireland. If you've done people that have lived in the US, done USMLEs, people in Ireland, people in New Zealand, those are a special category who can, of course, use that pathway to come to Australia. But majority of us who are IMGs will tend to use the standard pathway. So the standard pathway is a pathway that is used by junior doctors. It has two components. It has the two exam no essentially it has two components. The first one is the exam pathway, which we call the Australia Medical Council AMC exams, and then we cannot hear. um
Someone said we cannot hear.
mm,
So
what
which one, Dread? Which one can you hear me, Dread? Let's know where we're coming from. Doc, are you using sort of a device to speak?
no, I use my microphone. Do I get it off?
Yeah, try and get it off. Let's see.
Okay, let me just remove it.
Yes. All right. Can you
Can you
can you
hear
hear
me?
her now?
Can you hear me now?
Dread, can you hear now? Oh, we can't hear both of you.
mm. And now
Okay.
oh no, what's going on?
All right.
Can you hear? Um.
So someone said I can hear both. I can hear both. I can hear both. Okay.
Okay.
Yeah.
All right.
Okay.
That's good.
All right.
So.
You guys are confusing us. God. Thank you guys. Thank you guys. Let's make it happen. Doc. So Doc, you said there are three
I.
pathways
Mm-hmm.
if you want
Yeah.
to come to Australia as a medical doctor.
Yes.
So if you're in Africa, that most people from Africa that make use of whether you're in the UK or Africa, so they make use of the standard pathway, right?
I think if you're in the UK, it's different. So I
Okay.
say, if you're in Africa, like an international medical graduate in Africa, you will find that you will use the standard pathway. But if you're an African that's already working in the UK, then you will use the competent pathway.
Mm.
Okay, so you'll use the competent pathway. Like I mentioned earlier, the competent pathway will just be for doctors that have worked. They've done exams and they've had work experience in the UK, in the US, in New Zealand, in Ireland, those big four countries. Okay,
Okay. Okay.
but yeah,
Standard pathway. Let's go back to people in Africa first.
yes, that's what I'm saying. That's where a lot of us are. And that's the pathway I used. So, standard pathway, like I said, has the exam component, what we call the AMC exam. which is, you do it in various countries. It's available in various countries. You can sit it at. And then you have the second component, which is the AMC2, or what we call the work-based assessment. And then part of the requirements will be of the standard pathway. Of course, I have to let these doctors know. First and foremost, your university need to be a recognized university. And I don't know how I can share the link on how to see that, but a lot of universities are on there. That's a good thing. And then after that, you need to get your documents verified through a certain portal. And that's standard for everybody. People have to look at your people have to look at your certificates and make sure that they are actually real and legit. And then obviously after that, you apply through what we call the AMC portal, and then you put in your application to sit the exams. Okay.
Mm.
So that's what we call the standard pathway. After you sit the standard pathway, then after you've passed the first part of the exams, you can be eligible for registration, but you need few other things. So what you need in
Doc,
addition, Mhm.
Doc, is that's good. Too much information, Doc.
I'm
Easy.
rushing you.
Yeah,
Okay.
so
All
can you
right.
repeat again? No, the first thing is standard pathway for anyone in Africa right now. A
Yes.
doctor, I'm just helping you to,
Yes.
push this thing out so that they can
Yes.
return it. So if you're a doctor watching this and you're in Africa, somewhere in Africa,
Mhm.
so what Dr. Anne is saying is that the standard pathway is something that is really good for you. And the first thing you need to do is to be sure that your university, this link, we're going to share it in the comment section. I'll get the links from her and we're going to share it in the
Yeah.
comment section because this is
Mm.
a collaboration video. So you're gonna be sure that your university is an approved university
Mhm.
that Australia recognizes and can take their doctors in, right?
Yeah.
So second one is what did you say again?
So second one, after you do that, you have to take your certificate, your degree certificate,
Mm,
and get it verified. We call that verification of your documents.
yes.
Okay.
Third,
Third, you register for something called an AMC portal. In that portal,
what is
it's like
AMC, sir? What is
AMC in
AMC?
full is Australian Medical Council. I'm sorry.
You see what I'm saying? Like, Doc, I want us to just be talking like layman here,
Mhm. Um,
Because most people haven't tried it out before, you know.
mhm. Sorry. Mwambie simcheze.
Are you good, Doc?
I'm good. It's just that I'm told we are upside down, but we'll just continue.
No, but you're okay here.
Uh, okay. I think we'll just continue. All right. Sorry about that. So yeah, so after you do your verification of your documents, then you apply for what we call Australia Medical Council portal, and it is that portal that will allow you to book exams.
Okay, so this verification, is there a place they do it or something?
Yes. So again, I think we will need a link for that verification. I wish I could share what's on my computer, but I can't now. Um,
Yeah. After
yeah,
the
but I will
session.
share it. So it's essentially what we call primary source verification, and that's done by a accreditation body called, oh my God, I don't want to stress them out with all the names, ECFMG. So again, I'll share that. Yeah, but it's really straightforward. Please don't stress about it. It's very straightforward.
All right, good, Doc. Go ahead.
Yeah. So after that, after you've done, you have registered for the exams. I was saying, if you pass the first part of the exam, what we call the MC1, which is an MCQ exam that, of course, you have to prepare for, like any other exam. If you pass that exam, then you can be eligible for what we call limited registration. So limited, I'm trying to see, I don't want to give a lot of information, but so that I don't confuse you. But after your part one exam, you can be eligible for what we call limited registration. After your part two exams, if you've done both AMC1 and AMC2, you'll be eligible for what we call provisional registration. Okay. So for you to get limited registration, the only thing that you will need after you pass your exams is one, to have a job offer. And number two is to have recency of practice and what we call the English language test. Okay. Are we together? Okay. So for the English language test, there are many, or TOEFL or whatever it is that you'll use. There's a certain requirement. And then after that, recency of practice, essentially, you've worked for at least 4 weeks in one licensing period, like 4 weeks in a year, or a total of 12 weeks in 3 years. Okay. If you have that, if you have your English test and you have your recency of practice and you have a job offer, you can get what we call limited registration and you start working straight away. The other alternative, which will give you a better opportunity at getting a job offer, is if you've done AMC1, you've done AMC2, you have recency, and you have English test. That you can get what we call provisional registration. Okay?
Amazing, amazing.
Yeah, and that's all you need to come and work in Australia. So you need some form of registration, the job offer, and voila, you start your job in Australia.
Wow, Doc, that sounds so easy. So what Doc just
Um,
said to us is, if you want to come to Australia, and she just made she said you have to be able to know that if you are in Africa, then you can come through the standard pathway. There are three pathways. I can remember standard pathway, competent pathway, and specialist pathway. Am
Good
I
on
am I
you.
right?
Yes, yes,
Yeah. So Doc said if you are in the UK, she has not
yes,
talked about that yet, but she said you
yes,
can come through the competent pathway because you've taken
yes, you
your
can.
PLAB exams and you're
Yes.
already practicing. So the second one, and she's gonna explain that after now, I'm sure of that. The second one she talked about is standard pathway. That if you're in Africa watching right now, you're somewhere in Nigeria, in Kenya, in a
Mm,
state or somewhere watching this right now. So the chances of it is that she said you have to do what you call make sure that your school is in the verification stuff. The link will be shared out in the comment section after now. And she said after that you verify your documents through a particular body.
yeah, yeah.
The link will still be there. And then second one is once it's there, you now register with, if you now pass the AMC1, that you can do what we call limited registration.
Mm.
And
Mm-hmm.
then with that, you can now take your English test, have a
Mm-hmm.
band 7 in all of
Mm-hmm.
them.
Yeah,
And then, depending on the one you're taking, but the equivalent should be band 7.
yeah, IELTS. Yeah.
Yes. And then the next thing she now said is that at the end of the day, if you have the English test and have it, then recency of practice,
Mm.
there, I don't know, I don't understand that one at all. But whatever it is, you guys should just manage that one. I've tried. So, Doc, you can continue.
Okay. All right. So and that's essentially it for the standard pathway. So after you get your registration, which is the APRA registration, then of course you'll apply your visa. But a lot of times, if you have a job offer, a lot of people get their work visas really quick. That shouldn't be a problem because you don't need bank statements or all that. You just need your job offer and your registration, and you're good to go. So pretty it is straightforward, but of course, you have to study for the exams. I think that's where the catch is. You really need to prepare for the exams because you have to pass the exams.
Doc, how difficult is the exam?
Um, like any other exam, you have to work for it.
Because
I
when I was
think.
watching your video, I saw some people comparing the exam with PLAB. So I was confused because I'm not a doctor, but I don't know what they were discussing there.
I think people have different opinions. In my own experience, I did my AMC exams and I did it once, and there wasn't a lot of information out there. But regardless of
You're
the
very
little.
intelligent though.
No, it's it's not that. But like I always say, the difference between Australia and African countries, I must say, is Australians want a certain structure. Once you get that structure, once you know what they want, then you'll pass the exams because the way the exams are structured, and if you want to know a little bit more on this, you could check out my YouTube videos. But the way the exam structure is set up is is almost like what do you call it? An experiment. If you do the experiment right, you will pass it because they will ask. You know the way as in Africa you're taught. What is the commonest
Yes,
cause of
theoretical.
this? What is the commonest cause of this? But here they will give you a clinical scenario, and then they will ask you what is your next plan.
Yeah.
This. I'm hoping these people are doctors. Like for example, what's the next
Yeah.
step you can do for a UTI, urinary tract infection? You can decide you're doing a microscopy culture and sensitivity, but the question will ask you what is the next step. So the next step is not microscopy culture and sensitivity. The next step is doing urinalysis, which you'll do it in your office, in your practice. So it's just getting those little bits of differences that are in the exam. And once you know what they want, I think the exam is doable. But I do know that some people say plab and all that, but I know as well there are my good number of my friends that stay even the plab and USMLEs are also tough. So whatever exam you decide to do, at the end of the day, you still need to prepare for the exams.
Okay. So,
Yeah.
Doc, before we go to the next one you want to talk about, let
Mm.
me ask again. This exam, is there anything that one can do to be able to, know what is going to be like,
In the
be ready
exam?
for it? Yeah, to get ready for it.
Yes, they are. The Australia Medical Council has this handbook. I know a lot of people, I use the handbook myself, and the handbook just helps you to know the structure of the exam. I can hear myself echoing. So once you understand the structure of the exam through the handbook, then there are some people that offer short trainings. There are people that offer even free online groups. There are some free online Facebook groups that I know. One of the girls I've worked with recently, there is a Facebook group that people join, and in that Facebook, I said you have to be committed because the timings can be different. I know she was waking up like 11 to 3 a.m. just to join the sessions because of time difference. So there are
Yeah.
avenues to prepare for the exams, yes.
All right. So, Doc, thank you for the stage one. So now let me ask you. So, what about a competent one?
Okay, the competent one is quite straightforward. So what you need to do is the two components of the competent. So you need the exam component and the experience component. Okay. So by experience component, I mean you need to do PLAB 1 and PLAB 2 and work in the UK for a year. Okay. Ireland, you need to do the exam and have some work experience there, and then USMLEs as well. So there's the exam component, and then there's the practice component. So when people ask me this question, should I do PLAB and this, I tell them, even if you do it and you don't have the experience component, it doesn't help you evade the AMC exams. In fact, the only way that can help is what I've seen is some people come here as to do AMC1, and then unfortunately they're not able to get AMC2. But because they're already working on limited registration, then they decide to do PLAB 1, PLAB 2. And with those two, plus the experience that they've already worked here in Australia, gives them general registration. So some people do it that way. Okay. But just the exams without any work experience, unfortunately, will not be able to render you registration ready.
Wow.
Yeah.
Many ways to do this thing.
Yeah,
So,
many ways
so,
to kill.
so, so that's competent pathway, right?
Hmm.
All right. So, what about specialized pathway?
So specialist pathway, it is. I've seen a few people getting by with the specialist pathway, but I must say, because of the structure of how um, our training is done in Africa, we may not, be okay. So maybe let me put it this way: the specialist pathway, you have a specialist that's already specialized. Let's say you're an orthopedic surgeon, or you're a physician in your country, or a pediatrician, and then you have to apply through the college, the respective college. So here every specialist has their college. Like my college is the Royal Australian College of General Practitioners, and then some people Royal Australian College of Physicians, blah blah blah, and that. So you have to apply directly to the college, and then the college will categorize you into three. It will either say you're fully comparable, and the people that are normally found to be fully comparable again are from these
Oh,
special countries that I've mentioned. And then it can say you're partially comparable, meaning that you can come in on that pathway, but then you need to sit to be supervised for another 2 years and sit an exam. Or
okay.
it can completely say you're not comparable at all, and so you will have to, you cannot do that pathway at all. But I must say, so far, I have met a physician and I have met a pediatrician, psychiatrists, radiologists that have gone through that pathway. They've been successful. I think the difficult ones are places like the surgical fields. They are a bit hard to get into, not only for IMGs, but also even for the local graduates. But it's still possible, but harder to get in. Yeah.
Wow. Wow. Wow.
Mm,
So
yeah.
I have the we've talked about the specialists, the standard,
And the
and
competent.
the competent pathway. So,
Yeah.
Doc, now the question again is, there's this news that was talking about doctors in Australia recently,
Yeah.
as if last week or whatever. They said about cutting
Expedited.
down. Yeah. So what's that all about, please?
So there is just this November, October, I think 20 something, there is now what we call the expedited pathway. Okay. So the medical board, the Australian Medical Board, the AMC board has come up with a way to rush through the specialist pathway. The reason being there's a lot of shortage, especially in some specific fields like general practice, psychiatry, obstetrics and gynae, and anesthetist. So the board is taking over that sort of the process of allowing people to come in and registering instead of them going through the college. And I
Oh,
think there has been an uproar because the colleges may be missing out. I don't want to be
yes,
seen by my
yes,
colleagues. The
yes.
colleges may be missing out in terms of, because remember they get quite an income from you when you apply, because all these applications cost money. So of course when you apply through them there's a cost you pay, and then you apply through APRA to get your registration, there's a cost that you pay. So I think things going through the AMC board or APRA directly may, so that's just the uproar. But I think it's going to be something really, really good for a lot of, specialists. So if you're in the psychiatric, I think they're starting off with psychiatry.
Yes.
I saw obstetrics and gynae, general practitioners, and what's this other one? Oh God, there's one more. I think anesthetist, because there's a real, real need in the regional Australia for workforce. Yeah.
Wow.
Mm.
So, Doc, the next one is this is so. I hope these guys are doctors because too much information here, man. So, guys, listen. There's this thing out there. People say, when you talk about coming to Australia as a doctor, people just say it's not possible. Is this is not that. Now you've seen Dr. Anne for yourself. She is spelling it out. She is dishing it out gradually, giving everything it takes for that to happen. So, Dr. Anne, is there what is next in your own plan from there? So we can hear from you.
Say that again.
What is the next thing in your plan again? So we can hear from you because you talked about the pathways to come to Australia as a medical doctor. You talked about different things that need to be done. So is there
Yeah.
any other thing that you want to let us know
I
before we
think
proceed?
the only other thing that I need to let people know is, like you rightfully say, it can be, I think people just need to understand the process can be tedious, but eventually when you get there, and I always tell people, if you really want it, if you want to come to Australia, you can do it. Of course, there will be hurdles along the way in terms of finances, in terms of not knowing where you're going, fear of the unknown, and all that. But I think it's important to, just do it. I mean, just do it because it's going to be good. And I find people leaving it. I must encourage the younger doctors as well, because the quicker you do it, the easier it is for you to get into later on into trainings and stuff like that. If you asked me today if there was anything I would have done differently, is if I knew about Australia, I would have come as soon as I finished, my med school internship in 2 years. I would be, I would have left already. because then that way it gives you an opportunity to, juggle the trainings that you want. If you want a surgical training, you can actually prepare yourself and get into a surgical training and stuff like that. So the younger you can do this, the better. And also because of the permanent residence requirements, there's that caveat of 45 years and all that. So it's always good to decide if you want to come instead of leaving it to the very end to just quickly bang on. And doctors, guys, I must say, you're really privileged because when it comes to things like as soon as you get your general registration, it opens up a lot of doors. It opens up doors for training, it opens up doors for permanent residence. Imagine that's all you need. You don't need any more skills assessment. As long as you have general registration, there you are, bang on. And then it can open up so many opportunities for you as a doctor. And doctors here, when you apply for your permanent residence, it's nice, quick. You get your papers in, and you can live and really get the benefits that are associated with living in Australia. So whatever it is that if you've been on the fence and you're not sure, I must say just do it. Yeah, it will be good. um okay, so I think I forgot to mention about internship. Like for all this, for your registration period, you need to have an internship because you need to do your internship. I would say, because the internship is called here PGY1, they normally like to employ people from PGY2. So try as much as possible to do your internship in your country so you can get registered as a on full registration in your country, because you're going to need their papers, like when you come to the registration, you'll need them to
Yes.
send a good conduct, like a letter to the registration to say, this, we know this person, we've registered this person, they are a doctor in our country. So you need that. And if you can get a year on board, then that increases your chances of coming in and working with minimal supervision. So yeah, that's what I would say.
Wow.
Yeah.
Wow. So okay. So now right away, somebody asked a question, and I think we'll open the floor for question and
Yeah.
answer because we've come a long way. So I'll open the floor for question and answer as we continue to talk about other things. So somebody said, please, any age restriction.
I think the only time I talk about age is the age restriction, and this is not only for doctors. I think across Australia is just when you're applying for permanent residence. But I know people that come to Australia when they're like 50. I have a close
Yes.
friend that came to Australia when he was 50. He's in the general practice space. He works there. But for him, the wife had come in as a nurse. So the wife was the one that applied for permanent resident. And then he got it by the virtue of being a dependent.
Okay.
So the only time I talk about age is when you're the main person that's going to be, because at the end of the day you want to come to Australia and then you stay in Australia because you like it. You wouldn't want to, like, you want to go back and visit home, but you may want to stay longer, and for you to stay longer you need to get your permanent residence and thereafter citizenship. But to answer your question, you can be on a work visa for however amount of time that you are likely to need, regardless of the age. So age is not a key factor in working as a doctor, but it can limit you in getting your permanent residence. Yeah.
Exactly.
Mm,
Exactly. So,
mm,
guys, we're almost coming to this is the first time we're doing this, and
mm.
we're hopeful that, with time, if Dr. Anne, if she's happy to do it, we can always come around one of these days, one of these months. So, I have another question here, guys. Ask your questions. I'll be reading them. You are doing well. You are doing so well,
Imagine.
ma. Dr. Anne, I want to be adopted son, please. Who is this doctor?
That's
Oh
a
my
funny
god.
one. Yeah. I
All
have a
right.
lot
If
of. All
if
right.
it,
Okay, that's a nice one. Thank you.
yeah,
Thank you so much. Yeah. I'm currently doing my internship here in Nigeria, and I'm interested in Australia, but AMC is expensive. Any other way? Um, like I said, the exams are one. I think the last time I checked before we started, I think they're sitting at 1,500 and $48. That's for registration. I'm trying to remember the exam fee. I think it's around, can't remember it on top of my head, but I think it's
Okay.
around more than $1,000, I must say. So the exam is expensive, but I don't see any other way, because even if you did USMLEs, there's a cost to it. If you did PLAB exams, there's a cost to it. I guess it's just the price you've got to pay for this good life that you get to live. So
Yeah,
so
yeah, because I want to talk about the good life as the last part of it, because
mm,
when people hear about the doctors in Australia, they don't understand the remuneration, what it looks like, the benefit,
mm,
the reward. So another question here is: must you do internship in your home country first, or you are saying you recommend it
come straight. No, you
isn't
cannot come
compulsory?
straight from med school. I've read the question. You cannot come straight from med school, unfortunately. Internship is a requirement. Like I said, you have to be registered in your country, okay? Because, how do I put it? So you have to finish your medical training, and then you do your internship. Internship is a requirement. And then I would not highly recommend. You need to be registered in your country, because remember, as part of the paperwork that's required by APRA is the registration body. Is you have to provide evidence from your registered body in your country to say that you are a practicing doctor for you to cross over. So
Mm,
at the end of the day, you still need to do your internship,
yeah,
unfortunately.
yeah,
Yeah.
yeah. So that's true.
Um,
Are there materials or academics for AMC?
Um, there is the handbook usually. I know the AMC sells the handbook at a cost. Just can't remember how much it was, but there are soft copies. But I think what I would advise people is, I don't know if, because I did my exams a long time ago, but what I would advise is you get yourself into the Facebook groups like Amedex, or there are actually some Facebook groups that people get onto. I don't know. Do you want me to try and get one or two so people can? Precious, what do you think? And then maybe just
I,
suggest.
Doc, perfectly. This is your thing. I think it's a welcome
Yeah,
development
yeah,
because I think what people need is sometimes people just need a little bit
yeah,
of hand to
yeah,
just get to join two or people
yeah.
preparing for the same exam, and they can
But it,
network and just continue.
yeah, I think so. You can just check online. A lot of them will be like AMC preparation, and a lot of them are actually free. You don't have to pay
Pay anything.
upfront to join the Facebook groups. Yeah. What is the pros and cons of practicing in Australia? Do you want me to answer that?
Yes, yes.
I think the pros are more, I must say. And please check out my YouTube channel. I've done a lot more there. But in
Please
summary,
check out our YouTube channel. Doc has done a lot, to be honest.
but
Please.
in summary, I must say the pros are a lot. I mean, imagine you live in this country, you've got a home, you've got a nice place to work. I think if you check my YouTube channel, I think there's a video I've shown you of me going into work. The structure is good. If you're on night shift, you can get a place to rest. You can get a meal. You can get that was completely different from when I worked before. There's a lot of support at work in terms of, like, rarely will you be a junior doctor on call alone and stuff like that. The kids schooling, the security. I mean, you come and you just, you're not worried about security. The roads are good. The kids' infrastructure, I mean, parks everywhere. I mean, it is very conducive. For me, I think I wouldn't do it any other way. The cons, I must say, settling in can be difficult, but again, I've covered that quite a bit on my page, and I've given tips on how to counter that. So settling in can be a bit initially tough, but there are avenues to counter such. And then obviously getting your footing in terms of, like, deciding which course am I going to, because at the end of the day, you don't want to remain a junior doctor forever. You want to advance and become, a specialist in some form or some way. So I think those would be, and then sometimes I feel homesick. That's those are those are my main cons of living here. So yeah, I guess yeah. Uh, Please, with regards to the permanent resident application, how long will it take to apply for it after provisional registration? Like I said, as soon as you get your general registration, you can apply. So imagine if you are coming in with AMC1, AMC2, that's exactly 12 months of, actually it's 47 completed weeks. You apply for your AMC certificate and then apply for your general registration. As soon as you have your general registration in your hand, you can apply. Okay?
Somebody asked a question, very funny question. What's the pay like first year practicing in Australia post
Post
tax?
tax. Let me think.
They want to hear how much you made.
You are like, let's say, an RMO level 1 or 2. How do I translate that? We are not paid a month, we're paid fortnightly.
Yes.
So it should be about, my goodness, maybe 3,500 thereabouts. That's every 2 weeks. So that's what it is. But if you're a registrar, if you come in as a registrar, your pay is obviously more. And if you come in as what we call a senior medical practitioner, then again your pay is even more. So I always talk about this like an SMP is sometimes if you're working already in your country as a specialist and you can't get in here as directly as a specialist, you can come in as a senior medical practitioner. And if you come in as a senior medical practitioner, obviously the pay is even more. So yeah. So it just depends on what level you're at. Please, what's your Instagram handle? Would love to follow and ask more questions. Yes, we'll share that. For Australia, clinical experience applying for a visa to Australia, would it be difficult? What reason would you give for Australia clinical? Are you talking about what Australian clinical experience? Do you mean, Dread, I don't get you, but in short, if you are coming, let's say you, because some people do what we call observerships, which is essentially they apply to come to Australia and see how the system works. And I always tell people when you're coming in to do your AMC, if you decide you're coming to do your AMC exam in Australia, try and link yourself up to a doctor or a hospital so that if you're given 3 months, you don't waste those 3 months. You come in,
Yep.
sit your exams, and the remaining, like let's say 2 months before your visa ends, try and get yourself into a hospital or into a GP practice so that you see how the Australian system works. And that for that you will need a visitor, visa. And to get a visitor visa,
Yeah.
all you need is to give your AMC invitation letter, and you'll get your visitor visa. And then just try and because that's where you'll get your Australian references. I mean, people will say, we know her, she's excellent, she's a good team player, and stuff like that. So I think that would be good. So in summary, you need a visitor. Oh yeah, yeah, observership. You need a visitor. So you need a hospital to give you a letter to invite you for the observership, and that's all you need. They will not say no. All you need
Yeah.
is you put that letter in. You provide the fact that you're already working in your country, so you're not sort of running away and stuff. um, but
Yeah.
then they'll give you a visitor visa for sure. Being a registrar, what difference will it make? Precise advantages, please. Chisom, I will try to summarize, but again, really, guys, I really want you to. I know a lot of you want to ask me questions, right? But I do have a lot of this information on my YouTube videos. But essentially, a registrar. So if you look at definitions of doctoring in Australia, an intern is the lowest, and then there's RMO 1, 2, 3, and then after that there's registrar, and then there's a SMP, and then there's a consultant. Okay, so obviously as a registrar, you have a bit more clinical responsibility because you have to supervise your juniors, you have to take lead in some things like mobility and mortality meetings, things like code blues. You actually are the front person to manage a scenario. So I always tell people, if you don't have the clinical skills to be a registrar, don't apply for a registrar job because it's going to be too full on for you. But if you are, of course, confident in your skills and your skill set, then definitely come in as a registrar. The pay will be better, the clinical responsibility will be more, and then I think that's the main advantage, that the pay will be significantly different.
All
Um,
right. So someone asks, oh,
reptile situation. Okay. How about the reptile situation? You know, there is the stereotype that you stumble upon animals. Is it safe? I must say, I've lived in Australia now how many years? Almost 8 years. I haven't met a snake yet. I'm lucky. But I do know a friend of mine has, had a snake in their backyard. But I guess it depends on where you live, really. If you live in regional Queensland and stuff like that, of course, it's known to have more snakes and stuff like that. But I mean, come on, guys. Sorry. Um, I don't know. Precious, have you met a reptile?
I haven't seen it. Like, I'm so happy that you're actually making that comment because sometimes when I say those things, people just feel like I'm just trying to just defend Australia or something. And I tell them I haven't seen that here. I haven't. I've tried.
Yeah, and I must say, my friend, you just stay away. If you see a snake, you stay away from it and you call the snake catchers. They'll be there and they'll get it out for you. It's not a big
Yeah.
deal. Yeah. Someone asked about my Instagram handle is just essentially migrant doctor mom. So migrant doctor mom
My
is
granddaughter mom, yes.
yeah. What are the steps of AMC exam? And then, please, what are the steps for AMC exam? Okay. So, like I said before, AMC exams is just MC1 and MC2. So, MC1 is where it's an MCQ question. It's about 3 hours exam, and then you get the results after 4 weeks. And then the second part of the exam is like what we used to call back at home a viva. I don't know if you guys call it that way in your country, Nigeria or in the other countries, but here they call it like an OSCE situation where you get a clinical scenario and then it's like you're actually seeing a patient face to face.
Fiverr, yeah.
Yeah, it's like a viva. And then the other alternative to AMC2 is doing what we call a work-based assessment, which is essentially almost like a year of where you just work and then you submit, you do some various small components of like you meet up with somebody, you discuss a case, they see you putting a cannula, they see you taking blood cultures and stuff like that. So yeah, essentially that's it. um, if one has finished 2 years on 482 visa with same hospital, then for 186 visa, limited registration is enough. A skilled assessment or general registration is must. For 186, I used 186. You need to have general registration. You need to have general registration. And then Pat Doris is asking with pay. What's that? I'm not sure.
It's pay. It's
Or WBA is with pay. You work with pay, but you pay a certain amount to the Australian Medical Council. No, gosh, to the hospital. So the problem with work-based assessment is it's not offered in a lot of hospitals. So it's offered in a few hospitals, and because of that, it is highly competitive to get in. But if you get in, you actually get in as a doctor that's employed. And then as you work, you fill in the paperwork that's required. At the same time, you are getting paid. And then
hmm,
from your pay, you pay, it's cheaper to pay to the AMC. It's only, I think, 600 and something. But to the hospital that's training you on work-based assessment, you pay a good sum of money between 12,000 and $15,000. A lot of the hospitals will not ask you for that money at a go. You can set up for it to come from your pay slowly over the 47 weeks. So it's pretty good. I did work-based assessment myself. Yeah. And it is after AMC1, definitely after AMC1, and with limited registration. One get job in hospital providing WBA. Are all doctors getting to WBA within 3 years? Anyone can get a job in a work-based assessment. I guess it's like any other job offer. You have to go through the interview process, the application process, the selection criteria, the CV, the cover letter, and all that. And again, if you want just a bit of additional information, check out. I've done a video on work-based assessment, and within 3 years, what does that mean? One job. You can get into WB at whatever stage, really, if you're lucky. I mean, at the end of the day, it's very competitive, but people still get in. So just to position yourself really well. And I find some people, what they do is they know that this hospital is offering work-based assessment. They don't wait for the application process for work-based assessment. They get in like 6 months earlier, and then when you're there and you're doing a good job, there's no way they will deny you getting onto the program. They will give you
Yeah.
the program. So sometimes you just need to be smart with how you do things. Please, Dr. Anna, does your hospital offer observership roles? Because UK is saturated. Please, I will be asking you questions on IG, please. Okay.
All right, all right, all right. So,
Mhm.
guys, we have almost run out of time, and the questions keep coming. I believe that if we keep asking these questions, we'll keep going. So, we're gonna answer just four questions. No, three questions. The one that Doctor Anne is
Jay
gonna choose.
Patel. Jay Patel, I get what you mean. Limited registration can only be renewed 3 times. So before your 3 times end, try and get your general registration either by doing MC2 or by doing work-based assessment.
All right.
Hope that makes sense. Yeah.
Wow, 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 wow. So,
Yeah.
Doc, can you hear me?
Yeah, I can. Yeah.
So I mean, I'm very impressed because this is the first time that we're doing this here, and I see a lot of response. I'm seeing a lot of interactive sections and questions. So it means that they are open to
Yeah.
we'll keep progress and all of that. So guys, ensure that you subscribe to Dr. Ant's YouTube page and also like most of his Facebook page and
Yeah.
Instagram page. From there, you can contact and see everything she's doing. So at the moment, we will just give her another opportunity to say her last words and summarize for us today. And then, because some of us were sacrificing our sleeping time to be able to do this, Dr. Anne is already sacrificing a lot, and I'm also sacrificing a lot from here. All right, so guys, let's do this. Okay. All right, Dr. Anne. All right.
Yes.
Yeah.
Someone is asking about my YouTube handle.
Yes.
I think I just go by migrant Dr. Mama Crossboard, but yeah, uh, Precious, you share my handle. And
Yes.
guys, a lot of the questions you're asking, I've tried to tackle them. I always say if I can provide additional information, I can either via another video or yeah, but I think it's important to see what's already available because a lot of what you guys are asking, I've tried to put them into a video. And I must tell you guys, the reason why I started all this is because I was getting a lot of questions in my inbox. And remember, at the end of the day, you're still working, you still have family and stuff like that. And so that's how my YouTube channel was born, because I couldn't, continue giving like a lot of one-to-one. So what I decided was I was going to come up with a YouTube channel and just share my story, share your questions, and just cover to the best of my ability. And I think I feel like I've been doing that. And a lot of times then people ask questions there, and then it's a lot easier to answer if they've already like sort of gone through and understand the basics. But in a nutshell, I just want to encourage you guys, if somebody really is wanting to come to Australia to work as a doctor, I want to encourage you that it's doable. Yes, it can be tough, especially the financial side, but I mean, the benefits will outweigh. I
A
mean, even if
lot.
you were to take out a loan or something, once you get a job, you will sort of clear all that
Sort
within a
yourself
very
out.
short time, and you will live a life I don't want to tell you financially, but I must say, the financial incentive is really there, and the working conditions are really there. So all the
So
best,
let's
guys.
see.
Yeah.
All right. So Dr. Ann is saying, Dr. Ann, you have a lot of people saying, somebody say, Doctor, thank you, Dr. Precious Ann. No, so you said thank you, Dr. Ann, because I'm not a medical doctor. I'm already the host, not Dr. Ann.
Anna,
So
yeah.
yes, I'm going to. This video is going to be saved. Of course, it's going to be saved, so you can come back and watch it. But make sure you follow Dr. Ann. I'm going to share her link and a lot of things on the comment section after this. All right. So guys, I want to thank you guys for coming on board, and we'll be wrapping it up for today until further notice. Yeah, thank you everyone. Dr. Ann, what can you say? Your last bidding,
What's that?
your last words.
My last words are, remember to if you remember to subscribe on my channel, just
Mhm.
and listen to the videos, guys. They'll give you all the information you need. But above everything, I just want you to know that you're a doctor in your own element. You are already a qualified doctor, and you can do this. It may sound difficult at first, but you definitely can do this. If I did it, you guys can do it. And I really want to wish you the very best. And I'm looking forward to interacting with you guys again and with Precious on another
Occasion,
occasion. Yeah. Thank you so much for
definitely.
coming on board, guys. And thank you, Precious.
Doc, I should be the one thanking you for honoring my invitation and being able to do this with you.
Yeah.
I'm really grateful, and you're such a wonderful human. I appreciate, and I will also want to thank your husband for releasing you to be here. Because what if she says no, we can't do this, you know.
By
So
the
thank you.
if you see my videos are really good. He if the visuals are good, then it's courtesy of him for sure. Thank you.
Yeah, so I want
Uh,
to appreciate you so much and thank you so
thank
much.
you.
And we'll look
Thank you.
forward to what the turn up and also the responses.
All
We
right.
you do us a favor in the link section. Just help us probably to put out the
Okay.
links. Yeah.
Cool.
All
Yeah, I'll
right.
send it through. Thank you
Yeah.
so much, guys.
All
Have a
right.
lovely
Take care.
day.
All
Time. Bye bye.
right.
Bye.
Bye.